With Kern County having a high rate of diabetes, along comes the risk of having an amputation with that. But one local vascular expert says that amputations are not always necessary and can be prevented. Eyewitness News reporter Jose Gaspar is here with more on preventing amputations. Jose?
Dave, in this case, the numbers tell the story. According to government data, there are nearly 2 million people in the country living with a limb loss, and hundreds of thousands more amputations happen every year. That's why one local vascular expert hopes to get the word out that amputations can be prevented.
Danny Reda of Wasco is 52 years old. A few years ago, he started having some pain in his right leg.
I had an ulcer at the bottom of my foot that I've been curing for many, many years that would just never clear up.
Being diabetic, doctors told him at the time he had no choice but to have his leg amputated just below the knee.
One of the most common reasons for the amputation is the vascular insufficiency, where there's not enough blood, not enough oxygen to the tissues.
Dr. Vinod Kumar runs the Vascular and Lake Center in Bakersfield. He treats patients who are facing the possibility of losing a limb. Dr. Kumar says new technological advances have made amputations unnecessary.
Until a few years ago, we did not have the technology to open these small arteries below the knee, and that's why people would have amputation. Now we have the technology. We can get into these small arteries. We can fix these arteries without surgery.
People with diabetes are most at risk of having an amputation, followed by smokers. Other factors include being overweight, obesity, and lack of exercise. Blacks are 4 times more likely than whites to have an amputation. Hispanics are another high-risk group.
My mistake was I wasn't eating right. I didn't care. I thought, oh, heck, I'm young. I'm going to be all right. There's not going to be no problems. Well, here I am today thinking, well, this happened to me, and I'd like to see if I could prevent the rest of the people.
Though Danny Reda had one amputation, he was able to save his other leg in time.
If you're told that you're going to need amputation, somebody is ready to amputate your legs, please seek second opinion. Okay? The legs could be saved.
Health experts advise people to stay active, watch your blood pressure, avoid smoking in order to avoid having problems later on in life. Rachel?